Hi, this is a quick special ed lecture. I say quick because Intro to Special Education is typically taught as a semester-long course, but is not currently offered here at this university. Person First Language is a movement to be specifically mindful about what we say. And the idea is it's an individual with a disability, and it's just that. It's the individual first who also happens to have a disability. Like they may also have brown hair. For example, it would be correct to say Philippe, a student with an intellectual disability. It would be incorrect to say Philippe is an intellectually disabled student. Another example, it would be correct to say Seamus has schizophrenia, not to say Seamus is schizophrenic. If you have further questions about that, just send me a quick email. While this is typically the accepted language to use, it is not used with deaf individuals. The deaf community does not see being deaf as a disability, and therefore saying deaf student is considered okay. Autism has recently started to make a move in a similar direction as well. In general, my friend Adam says, and he says, nothing about us without us. So if you need to refer to the person and their disability is important to that description, ask how they would like to be referred to. So as we think on how we use our language, we should also think about what we can do in the environment, specifically our classroom, to level the playing field. Universal design for learning is a set of principles, again, originally based in architecture. I apparently just misspelled architect on the slide. I apologize. But it highlights differentiating instruction, and you can do that based on content, process, or product. That is, based on content, individuals may be learning the same topic but using different materials. If you're doing it based on, I think if you're based on content, yeah, they're learning the same topic but using different materials. If you're doing it on process, again, same topic, but students differ in how they move through the assignment or activity. If they're differentiating through product, same topic, but students demonstrate their knowledge in different ways. This can be done a multitude of ways, and while it requires more planning and prep, it's better for students. There were specific examples in the reading on how to differentiate based on the product, process, or content, but here's another way to think about differentiating outside of school. And this would be based on process or product, depending on how you look at it. So let's say you're at the gym and you're taking an aerobics class and it's time to do push-ups. Those with a higher level of strength will do the traditional push-up on a stability ball. That is, you're having to stabilize yourself as well as do the push-up. Those with less strength will do the traditional push-up on the floor. And those with even less strength will do knee push-ups. Again, differentiating can happen anywhere, anytime, and it was based in architecture, and it's just good sense. Determining eligibility. Not everyone receives special education services. Some are qualified soon after birth, and others are not qualified until their school years. To qualify, you must qualify under one of the categories of eligibility that was mentioned in the reading. And before the referral to special education, there has been a process, often referred to as the pre-referral process or response to intervention, RTI, that allows teachers to make accommodations for the students' learning and to try research-based strategies and to take data on those items to see which strategies or which accommodations worked and which ones didn't. As talked about in our research lecture, you want to take the data so that you can unequivocally show that a certain strategy or accommodation was or was not successful. To receive special education services, there must be a yes to the following three questions. First question, does a disability exist? Does the disability adversely affect educational performance? And can the student's needs be addressed through special education? If the three questions have an answer of yes, the student will have an IEP, individualized education plan, or I've also heard individualized education program. The IEP team must consist of a guardian, district representative or school administrator, someone who can interpret the results of any evaluation, special ed teacher, and a gen ed teacher. If the student is 16 or over, they also must attend the IEP meeting. That is, sorry, the IEP is a document and there is a meeting at least once a year. Other people, other than whom I've mentioned, can be invited, but the list I provided, those must be included. And sometimes people can serve two purposes. Like if you have someone who is interpreting results of evaluation, they may also be the district representative. IEPs can look slightly different depending on your state and district. For example, the state of Kansas recognizes gifted as a student who can have an IEP, and California does not. At least Kansas used to recognize that. I don't know if they still do. But the idea is it will vary slightly. The components of an IEP must include present level of performance, that is, how the student is performing in the areas of the disability, annual goals, short-term objectives, related services, supplementary aids and services, assistive technology, and that's technology that helps the student be successful. So the device that Samuel was using in the second video falls under assistive tech and is called an AAC, or augmented and alternative communication device, AAC. You must also think about participation with peers who do not have a disability, dates and places, measurement of progress, and they have to report the same as students without disabilities. So if the district you're in reports typical developing students every 9 weeks, then the student on an IEP, the parents or the guardians must receive progress on their child's IEP every 9 weeks. There are other components if the student is over 16, but we're not going to go into those today. The IEP must be reviewed annually and include the members that I just mentioned. And then every 3 years, there is a reevaluation, and that's to make sure the student still qualifies for special ed. And they ask the 3 questions that I just mentioned. And again, you're looking for a yes to continue with those services. During the IEP meeting, it will be discussed about the interaction the student will have with peers that do not have disabilities. The idea is that students are always placed in the LRE, or least restrictive environment. And the least restrictive environment is the general education classroom, because that is where the typically developing peers are located. And the most restrictive is going to be a facility. Again, you're going to take into account where the student can be most successful. And that may be the gen ed class, or it could be the general ed class with some resource room. They go, see the special education teacher maybe 45 minutes, 3 days a week, or they just see them for reading or something like that. Or it could be a private facility. It all depends on what the students need and what the team decides. Remember back to the Comptroller for a Day project? Districts with higher number of students with special needs tend to get more money. So if you have a student in your district and they're placed in a facility, because that is what is best for them, the district just lost out on that money. Of course, the people making the money decisions and the people who are teaching the individuals who might need to be placed in a facility are not the same group of people. So you can see how that may be a concern. The reason we're using teams in this class is because there are a lot of people that are required to work together to help some students be successful. And that is definitely in the special education classroom, but specifically also in the general education classroom. And have to work together, so we're building those skills now. Thank you for your time. Have a good one.